I'm Brett Day Windham. I am an artist and independent curator. And for the past 6 months, I have been researching and preparing for this exhibition about Martha Chase. I'm from Providence, Rhode Island, which is where I was raised and where I live now. So it has changed a great deal. Um, in Martha Chase's lifetime, the city of Pawtucket had just become part of Rhode Island. At first, it was part of Massachusetts, and it was a town that was filled with workers in the textile mills who were pretty close to indentured servants. The whole families worked in the mills. They were paid in store credit and company credit that they could use at the company store. They lived in company housing. And then there were the very rich founders of the mills. There was a small group of families that were building immense wealth to make themselves more independent from England and from Europe. Pawtucket fell on really hard times after the Industrial Revolution because industry moved overseas. So the mills were unused for a long time, and now they're filled with a variety of small businesses, artists, costume jewelry, plant stores, you name it. And there are a lot of interesting things going on in those buildings. A lot of them are connected to Brown University and Rhode Island School of Design as creative minds settle in the Providence area. And the line between Providence and Pawtucket is so gray at points where they kind of bleed over into each other. And it's really a university town and a town full of thinkers and makers and readers. And it's a really interesting place to live. Interestingly, a lot of people aren't aware of Martha Chase yet. Her family's legacy on the region is strong. She descended from Joseph Jenks, who founded the city of Pawtucket. And there are Jenks Street, which I grew up on the corner of. Joseph Jenks married a Brown from the Brown family that founded Brown University. And then she married a Chase, and the Chases were another huge family, founding family in the region. There are Chase centers and Chase buildings all throughout Providence, and the Chase family is still prominent in the region. So her family name, all of her family names have really shaped the region, but I think not enough people are aware of her.
Hello, my name is Nicole Frazier. I'm a faculty member at the Old Dominion University School of Nursing, and there I serve as a simulation educator. In that role, I have the opportunity to serve our undergraduate students as they enter as juniors and then see them all the way through the curriculum when they graduate as seniors. I come to the university with a background in simulation education as a United States Air Force officer where I served for 22 years. I also have a background in labor and delivery and women's health.
So this is a complicated and really good question and a complicated answer, which is part of what makes Martha Chase so interesting and researching her so rewarding. Um, Martha Chase was part of the progressive movement, and she was really interested in child development, and she also came from a family of doctors. So those interests coalesced in this idea that she had for making a doll that children could play with, where they could really use their imagination, and it wouldn't be automated or fragile like a porcelain doll. And then she wanted to make them safe. She wanted children to be healthy and happy and safe. She wanted a doll that was not fragile, but could be cleaned. So that's how she came to this idea of the sanitary doll. And a doll that could be cleaned and handled and manipulated lent itself really, really well to training nurses. The sanitary dolls were pretty revolutionary. She invented a top secret process to make them. The textile mills in Pawtucket created a lot of materials for the medical industry, and one of the main ones was stockinette. And this is an example of stockinette. It's a woven tube that expands. It's 100% cotton, and it's still used between the skin and a cast to protect the skin while it heals, keep it dry. She realized that this very available material, and being the daughter and the wife of a doctor, and her brother was a doctor, these materials were around her all the time. She could use this pliable cotton to mold a face for the doll, and no one had ever done this before. So she had molds made of the faces that she wanted. There is a lot of disagreement about where those molds came from. A lot of people think it was from porcelain dolls from Europe, because she wanted them to be really pretty. And they would press the stockinette along with sizing, which would have been insect-derived or animal glue, and left to cure, creating a hardened doll head. And it would then be painted with more sizing, painted with oil paint, and varnished to protect it. The body was also made with sizing and 100% cotton and carefully sewn to look as realistic as possible while still being soft and pliable, dressable, so that nurses could learn to turn and dress and bathe a patient. And this was the first time that nurses didn't practice on live patients. So this was a huge change in medical history. This is one of the child-size hospital dolls. Martha Chase started out with a hospital doll that was a full-size adult. She was 5'4", and the doll was affectionately named Mrs. Chase. After that success, she was asked to make child-sized dolls. So she made 4 child-sized dolls. Some of the differences between the regular play dolls that she made are that they have port openings in the ears. This one didn't have it in the nose yet because developments were constantly being made. And they're weighted to the hospital medical standard for weight and height at each age, so that nurses in training would really experience what it would be like to lift and move and treat a child that age.
The high fidelity mannequins that we have in our simulation lab are made out of a variety of different materials that are constructed specifically for the nature of being pliable and very human-like, so that our students are able to manipulate, do things such as starting IVs, and then also some of our mannequins, such as our Victoria mannequin for labor and delivery, can go in different positions. There are also different rubbers that are considered and used with those high fidelity mannequins, as well as the electrical component. The electrical component allows our students to be able to palpate pulses, to be able to hear different and auscultate different lung sounds, heart sounds, to have a variety of different sounds come from the patient. So the electrical component is a large piece, but also the materials that go into making the mannequin work together to make this the most realistic, high fidelity experience we can provide for our students.
Cholera, even some outbreaks on the west coast of bubonic plague, but they would have been aware of them. The flu, for which there was no vaccine, the common cold, and the Spanish flu.
The ailments that our nursing students are learning to treat today in our undergraduate program are driven from the disease processes that we see a higher prevalence of. So things like diabetes, hypertension, cancer. So while our students learn about specific ailments, the thing that's really important that our students are able to demonstrate is what are the things that are important to be preventative. So prevention of different ailments is really what we want to focus on. And then of course the treatment. But our emphasis also is on caring for the patients across the lifespan.
At this time, she is still an unsung hero. But she was really pretty revolutionary with what she was able to achieve during a time where, although she was a woman with really high social stature, women were not given much agency. So the fact that she was able to make innovations in multiple fields, start a company, hold patents, pass the company down to her children who kept it going. These are all really impressive things for a woman of her time to have been able to do. The innovations that she made changed medicine forever. Her first hospital dolls evolved slowly to the sim dolls that are used in nursing today. So I think, her progressive views on the right of children to be able to play, and health, and sanitation, and kindness, I think that was the legacy that she would be the most proud of. I think you can see her humanity in them.